Hello and welcome to our monthly webinar. I'm Dr. Kim Harris, and today we're going to be talking about skin resurfacing treatments. I did want to mention before we get started that you can ask questions. Over on the right-hand side, there's a chat box. I'm going to just write a quick note, and if you have any questions, go ahead and throw them up there, and I'll make sure to get to them as we go along or for sure by the end. All right, let's go ahead and get started. So the reason I wanted to do this webinar today is because there's some misinformation and possibly a little bit of fear around skin resurfacing, things like peels and other topical applications that we can do to kind of work on the surface of the skin. But it is a very important part of the overall aesthetic practice that we have at Prescott Medical Aesthetics. So here's, a little bit about me. I'm a naturopathic doctor. I own Prescott Medical Aesthetics here in Prescott, Arizona, and we do, I guess it's Prescott Medical Aesthetics and Wellness now, because we do offer a full range of aesthetic treatments as well as wellness services, IV therapy, we have another doctor on staff that does herbal medicine. She does, wellness visits, weight loss, IV therapy, IM injections, as well as all of our injectables like Botox, fillers. We offer, laser treatments, IPL photofacial, laser hair removal, and then facials and peels as well. So we'll talk about some of those services today, but we are trying to offer kind of a more holistic approach to wellness and beauty with all of our practitioners here. All right, so, a lot of people already know these causes of damage to the surface of the skin, and they actually can make the signs of aging look worse. So, sun exposure is always number one. Everybody knows we need to be wearing sunscreen on a daily basis. And not only does that cause pigmentation damage, so if you see sunspots on somebody or like darker areas, it causes that kind of damage, but also makes, lines and wrinkles look worse. It can also cause redness in the skin. And so really protecting your skin with an SPF 50 is what's going to make the biggest difference overall in the quality, tone, and texture of your skin. Loss of the skin barrier or damage to the skin barrier. This is actually something that we haven't discussed in webinars before, but we'll talk a little bit about what that means and how to repair it. But, your skin is a barrier in and of itself. And then we have specific layers that are designed to create a barrier between you and your environment. And when we, have too much damage from whatever, sun exposure, environmental factors, or we're just not taking good care of it or doing too much to the skin barrier, we're going to have a breakdown, and that can cause damage too. Good thing is it's fairly easy to repair, looking at different factors, skincare, things that we do, what we put in our body. But making sure that your skin barrier is in good shape is going to be important as well. And then, there are some studies that show that things like smoking around us and air pollution can cause more rapid aging to the skin. All right, so let's talk about a little bit about what skin barrier is. So this photo or this drawing over on the left is just a picture of the epidermis of the skin. And as you can see, there are quite a few layers in there. And they each have a different function. But what we're talking about when we're looking at skin barrier is the stratum corneum, which is the one on the very top. Basically what it is it's just a bunch of dead skin that's about ready to be shed. There is water and oil in there. And when we have damage to this layer, what you start to see are signs of aging, dry, flaky skin, redness, and irritation. That can lead to, skincare that you're using not being able to penetrate as well and be as effective. Um, it can also lead to like a dry, irritated red look when that is broken down. If you've felt your skin and it just feels rough and dry, that really is an issue with those top few layers of skin. So how can we repair this? Well, the first step, honestly, is skincare. And that's part of the reason that we love Epionce at our office, because they really do focus on repairing the skin barrier in a more natural way. So they have a lot of information on their website. Elaine also is very knowledgeable about this. She does skincare consultations. But what you put on your skin every day is going to have a huge impact. So we do recommend when patients come in and they want to, they're looking at Botox, they're going to make a significant investment into their skin. Part of that should be a skincare regimen, because that's what you're doing on a daily basis. You may only come to see me every 3 months for some Botox, but every day, making sure your skin is cleansed properly, hydrated well, with the proper ingredients to repair your skin barrier, nothing is going to be more effective than those two combinations, coming in for professional treatments and using a good quality skincare line. So, there's a few, oh, sorry, that got kind of messed up. A few basic products that we recommend on the Epionce skincare line, and those can be customized to your specific skincare needs. But, on a base level, we want everybody using a good cleanser that is specific to their skin type, whether you're dry, combo, or oily. If you have acne skin, we've got a cleanser for that as well. The renewal lotion products, or the renewal products, are really what are most focused on skin barrier repair. So we've got some lotions, and then there's also a serum as well that will help with that repair and hydration. So you'll notice the big difference when you start to use that product. As far as like your skin clearing up, you're going to see less redness, and you're also going to see better hydration status in the skin. Because if you remember what we were talking about with that top layer is that it's water and oil. That's kind of what holds it together. So if you're not hydrated, drinking enough water, if you don't have the right balance of oil in there, you're going to have an imbalance in that skin layer, and that can look like acne, redness, flaking, dryness, irritation. The lytic treatment, that's actually our anti-aging portion of this protocol. We have different levels of it, and basically what it does is it helps at home with cell turnover. And what we're trying to do is shed the appropriate amount of skin from that top layer to get your skin in better shape and looking better. So the Lytic TX, there's a light one, there's the regular one, and then there's a heavier duty one, depending on your skin type. But what that's going to do is help at home to get some of those layers of skin turning over in an appropriate manner. So it'll help with dryness and helps with like fine lines and wrinkles. And then of course we always recommend sunscreen. Or one of our top selling products is the daily tinted sunscreen, 50 SPF, has a really nice color to it. Most of our staff just wear that. They don't wear makeup anymore. So it's a nice way to protect, hydrate, and also just have like a nice even skin tone. All right, so let's talk a little bit about treatments that we offer in office. So once you're established on a really good skincare routine, then, we really start talking with most of our patients about peels. And I will say that nothing has changed my skin more than getting peels on a regular basis. I actually don't think I'd ever had one before I met Elaine. And now I do them, monthly if I can, if I have time. But really, that will help, get rid of so many skin issues if you're using the right peels in an appropriate manner. So, like some patients, as soon as I mention the word peel, their walls are up. They're like, nope, I'm not doing a peel. I saw my friend do it. Her face peeled off. She looks terrible. And that just is not the case anymore. There are very deep peels that you can get. and we offer one of those, but we really don't find that you have to have a deep peel all the time to get great results. I get compliments on my skin on a regular basis, and what I do is the light peel that we're going to talk about in a few minutes. So, what peels are doing is helping shed some of those top layers of skin. So if you feel that your skin is getting kind of rough and dry, it's time for a peel. If you have any pigmentation, if you have fine lines and wrinkles, if you have any redness or irritation, it's just time to start getting into a peel regimen. And that's just going to get rid of all that old buildup. It honestly makes your skincare more effective. So if you're investing in skincare, peels are going to make that even better. Just a quick look into a few of our peels. This is, I think, I know it is our most popular peel. So this is from the Epion's line. It's the Light Peel Refresh. And basically what it's doing is just increasing cell turnover, getting rid of those top layers of skin a little bit more quickly than you would see with an at-home treatment. It's going to help improve skin congestion, get rid of any redness, dullness. It can help with acne. And this one really, we see no downtime with it. So you can come and have it done, go back to work right after. You're not going to peel in the traditional sense. So it does take a few more treatments to see those results, but you'll notice a brighter, tighter, fresher look immediately. But we do recommend a series of 4 to 6 of those. This is kind of our middle tier peel. It's called the Sally Mally because it's salicylic and malic acid applied into separate passes. So we put the salicylic on, wait a little bit, wash it off, apply the malic acid, wash it off. And this one is a little bit of a deeper peel, so you do get a little bit of stinging and burning with it, and you will likely have some peeling. Not everybody does, but if you've got pigmentation, like hyperpigmentation, sun damage, that likely will get darker and shed off. And some people like that, like they want to see that visible peeling. You just have to consider that when you're looking at your downtime. So I'd still say minimal peeling. Most people go back to work with this one, no problem. They just are going to shed some skin. Again, this is going to be a series. This one should be done about 4 weeks apart, and it's great for, maybe kind of more severe skin concerns if you've got persistent acne that's hanging around, if you have more sun damage, and will help more with the signs of aging. This is a great peel to do once a month. And then kind of once you've got your skin where you want it to be with your skincare and the peels, then you can drop down to the light peel and just do that every 4 to 6 weeks. The VI peel line is kind of our Big Daddy peel. So this one, you're going to peel a lot with it. Most patients do. And there's, I think, 6 different peels right now that are specifically formulated for skin concerns. So, we can do for kind of younger patients that are looking just to brighten up their skin tone. We do the base VI peel. 2 to 3 of those is usually enough. But then they have ones that are specifically formulated for things like acne, collagen stimulation, like kind of deeper signs of aging. We use the Precision Plus for that one. That's actually my favorite peel. But this is for people that want quicker results and they're willing to have the downtime with it. So really you do have 2 to 3 days of pretty severe peeling in the face and the neck. So usually we'll have patients do this on like a Wednesday night or a Thursday morning, and that way they do most of their peeling over the weekend. Because really you're going to sheet peel with this one. So this one's really great to do in the fall, honestly, coming up, because, we're not as exposed to the sun. We want to get rid of that sun damage that we've gotten over the summer, and it can leave you with a very healthy, refreshed, and radiant look. All right, so those are all of our peels. Those are going to work on really damage to the surface of the skin. Microneedling, we have two forms of microneedling, and these are really going to help with kind of deeper lines and wrinkles. So you can see that these two patients, the before and afters, these are not fine lines and wrinkles. These are deeper acne scars, and then deeper kind of sleep lines and collagen loss that this patient has gotten. And really what we're doing is we're creating some controlled damage to the surface of your skin. So we're going a little bit deeper into the epidermis. We're looking at 0.5 to about 2.5 millimeters in depth. So not super deep. You can get a little bit of bleeding with these, but that's what we're trying to do, is create damage, and then your body sends in growth factors and really helps repair the area. So we do see new collagen formation with skin pen treatments. With this one, downtime is honestly quite minimal. The procedure takes about an hour, and you look like you've had a mild to moderate sunburn for about 48 hours. So this one, we can use PRP with it, which is from your own blood, completely natural procedure. So this is great for our patients that aren't wanting to do any kind of chemical peels or that have concerns of deeper fine lines and wrinkles. And this is done as a series as well. And we consider this a resurfacing treatment because we're really working on the surface layers of skin. You may get a little bit of peeling, a little bit of sloughing with this procedure, but not a whole lot. So most patients are fine to go back to work right after, continue working the days after this. I'd say, a week before an event is probably ideal. And then, this Secret RF is our heavy hitter as far as collagen stimulation goes. This is gold standard for non-surgical facial resurfacing. And the most amazing thing about it is that we see wonderful results with basically no downtime. You may look like you've had a sunburn for a day or two afterwards, but most patients don't even have that, honestly. So, this is also a collagen stimulating treatment. It's microneedling that goes a little bit deeper than skin pen does, but has some radio frequency at the end of the tips. And so we get, penetration into the skin, but also that heat causes coagulation of the blood. So we don't have any bleeding with this, and makes the downtime very minimal. It works with fine lines and wrinkles, even I'd say deeper lines and wrinkles. Helps a lot with skin laxity, and then can help some with hyperpigmentation. It wouldn't be my go-to for pigmentation, but if you have several of these concerns, then this is a great treatment for all of those. Also very effective for acne scarring and for stretch marks as well. So anywhere where you have, kind of deeper damage to the skin, Secret RF is going to be our best tool for treating that. And then, whatever your concerns are, pretty much no matter what, we're going to be looking at a combination of treatments. Definitely getting really good skincare online. You may be doing peels and microneedling, one or the other. And then we use injectables to help address kind of deeper underlying issues, relaxing muscle movement, using dermal fillers to replace volume in the right area. But if you're just focusing on one or the other, you're really missing out on a big piece of your skincare game. So making sure that we're working on the surface and what's underneath is going to give our patients the best results. All right, I have not gotten any questions so far, but if you have any questions, please feel free to type them in the office or in the box on the right-hand side labeled chat. I'm going to leave our contact information up here. If you have any questions, we do free consultations for patients for everything, for any of our wellness services, any of our aesthetic procedures. If you're new, if you're coming from another practice, we're happy to answer all of those questions for you. We have a lot of other webinars on our YouTube page. There is a ton of information on there. So if you're interested in any specific procedures, you can check that out. Our website is up there, www.prescottbotox.com. And if you want to schedule, you can give our office a call at 928-277-7414. We did have a question come in about Secret RF, She asked how often she can do it, and we always start patients off with a series of 3 that are 4 weeks apart. And you're going to see your best results from that about 2 months out from your last treatment. And then after that, it's fine to do it quarterly, every 6 months, once a year, kind of just depends on, how severe your skin concerns are, but not closer than 4 weeks. And then you can just continue doing that treatment until you see the results that you want. Awesome question. Thank you so much for asking. And I'll stay on a few more minutes if anybody has any further questions. I appreciate you attending our webinar today. We're going to be having another one later on this month. You can register from our Facebook page or just give us a call to register, and we do webinars once a month. So stay tuned for further information.